The Management of Inflammatory Bowel Disease. A comprehensive guide to understanding and treating inflammatory bowel disease. Welcome to our podcast, where we take a deep dive into the management of inflammatory bowel disease, a chronic and complex condition affecting the gastrointestinal tract. Today, we will guide you through a structured, goal-oriented approach to care, focusing on the latest strategies, multidisciplinary teamwork, and patient-centered decision-making. Let us begin by understanding what inflammatory bowel disease truly entails. Introduction to inflammatory bowel disease. Inflammatory bowel disease is a chronic, immune-mediated inflammatory disorder primarily comprising two main conditions: Crohn's disease and ulcerative colitis. The management of this condition requires lifelong attention and aims to achieve and maintain remission, prevent complications, and enhance quality of life. This is a team effort, involving not only gastroenterologists but also colorectal surgeons, dietitians, and specialized nursing staff, such as stomach care nurses. The core principles guiding management are as follows. First, the goal is to induce remission, which means resolving both the active symptoms and the underlying inflammation of the gut lining. Second, it is essential to maintain remission, or in other words, to prevent future flare-ups. Third, we must prevent and manage complications, which can be either intestinal, such as strictures, fistulas, or cancer, or extraintestinal, such as arthritis and skin manifestations. Lastly, optimizing nutrition and improving overall quality of life remain central goals throughout care. Treatment strategies are highly individualized, depending on the type, location, and severity of the disease, as well as patient-specific factors and responses to therapy. Diagnosis and assessment. The foundation of effective management. Before any treatment can begin, an accurate assessment is crucial. The first step is to distinguish between Crohn's disease and ulcerative colitis. Crohn's disease can affect any part of the gastrointestinal tract and is characterized by inflammation that can penetrate through the entire wall of the bowel. Ulcerative colitis, in contrast, is limited to the colon and involves only the innermost lining. Determining the exact location and extent of disease is also important, as is assessing severity using standardized scoring systems. The behavior of the disease, whether it is primarily inflammatory, causing narrowing of the bowel, or resulting in penetrating complications such as fistulas, guides therapy. Objective measures, including stool markers like calprotectin, blood tests for inflammation, and imaging studies such as magnetic resonance or computed tomography scans, play a vital role in establishing the baseline and monitoring progress. Pharmacologic therapy. The cornerstone of treatment. Medications are the mainstay of inflammatory bowel disease management, and treatment can be escalated stepwise or started aggressively, depending on disease severity and the patient's unique circumstances. For those with mild to moderate disease, medications known as aminosalicylates, such as mesalamine and sulfasalazine, are often used as first-line therapy, particularly in ulcerative colitis. These drugs come in oral, enema, or suppository forms, especially when disease is limited to the lower bowel. Corticosteroids, such as prednisone or budesonide, are reserved for short-term use during flare-ups to induce remission. It is important to note that corticosteroids are not suitable for long-term maintenance because of their significant side effects. When the disease is moderate to severe, or when remission needs to be maintained, immunomodulatory drugs are introduced. Examples include azathioprine, mercaptopurine, and methotrexate. These agents help reduce reliance on steroids and are sometimes combined with advanced therapies for greater effectiveness. Regular blood monitoring is essential to track potential side effects, such as bone marrow suppression or liver toxicity. Biological therapies have transformed the management of inflammatory bowel disease. These advanced treatments target specific proteins in the body's inflammatory pathways. Agents that block tumor necrosis factor alpha, such as infliximab and adalimumab, are highly effective for both Crohn's disease and ulcerative colitis, particularly in severe cases or when complications like fistulas are present. There are also therapies that prevent immune cells from entering the gut, such as vedolizumab, which is gut-selective and carries a lower risk of systemic infections. Other advanced treatments include medications targeting interleukin-12 and 23, and oral agents known as Janus kinase inhibitors, which have a rapid onset of action but require careful monitoring for specific side effects. Additional oral therapies, like sphingosine 1-phosphate receptor modulators, are also available for select patients with ulcerative colitis. Non-pharmacologic and supportive approaches beyond medications. Nutritional therapy plays a significant role, especially in Crohn's disease. Exclusive enteral nutrition with specially formulated liquid diets is a first-line option for children and can also benefit adults, primarily by inducing remission and correcting malnutrition. In ulcerative colitis, while there is no specific diet, maintaining good nutritional status is important, and dietary adjustments are often tailored to the individual's needs. Smoking cessation is a key component of care for patients with Crohn's disease, as tobacco use is associated with worse outcomes and a higher likelihood of surgery. The effect of smoking on ulcerative colitis is less clear. Symptomatic treatments, such as medications for diarrhea, can be used cautiously in milder cases but are generally avoided during severe flares to prevent complications such as toxic megacolon. Surgical management. When and why it is needed, surgery is an important therapeutic option and should not be viewed as a failure. In Crohn's disease, while surgery is not curative, it is necessary for managing complications like strictures, fistulas, abscesses, or when the disease does not respond to medical therapy. The focus is always on preserving bowel length, given the risk of disease recurrence. In contrast, surgery can be curative for ulcerative colitis, with the removal of the colon and rectum. Indications include disease that does not respond to medication, development of precancerous changes, or the occurrence of life-threatening complications. Surgical options include a permanent stoma or reconstructive procedures that allow for normal defecation. Monitoring and prevention. The treat-to-target philosophy. Modern management emphasizes proactive monitoring and aiming for specific treatment targets, such as the healing of the gut lining seen during endoscopy. This approach, sometimes called treat-to-target, has been shown to improve long-term outcomes and reduce the need for hospitalization and surgery. Regular follow-up with objective markers, imaging, and endoscopic assessments guides timely adjustments in therapy. For patients with long-standing ulcerative colitis or extensive Crohn's disease affecting the colon, regular surveillance colonoscopies are essential to detect precancerous changes early. Key takeaways for optimal care. Management of inflammatory bowel disease is highly individualized. What works for one patient may not work for another. Objective monitoring is crucial. Treatment should be guided by more than just symptoms, relying on laboratory and endoscopic evidence. For those at high risk of poor outcomes, early introduction of advanced therapies is becoming the standard. Multidisciplinary collaboration among medical, surgical, radiological, and nutritional teams ensures the best possible outcomes. Finally, surgery should be seen as an important therapeutic option, considered at the right moment for the right reasons, rather than as a last resort. The field of inflammatory bowel disease management is rapidly evolving, with new drugs and therapies emerging regularly. These advances offer hope for better disease control and an improved quality of life for patients living with these challenging conditions. Thank you for joining us on this comprehensive exploration of the management of inflammatory bowel disease. If you enjoy our content, please like, share and hit the subscribe button. It's the Everything Surgery Podcast. Dissect the Extraordinary.